I want to bring in my good friend, Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. Joe, good morning. What do you have on your list today for us, my friend?
Hey, Ray. Good morning. How's this holiday season?
It's doing well. How about you?
Everything's good. A little crazier, a few more little kids around again, and we love it around our house with some grandkids, so it's awesome. Thanks, Ray. I wanted to talk today. I wanted to go in the simple direction, okay?
Mm-hmm.
Keep it simple. And I'm going to talk about one of the things that we do as we evaluate athletes in our office or on the field and on the court. And it's a pretty simple test. And so people come in to see us if they have an ankle injury, foot injury, heel problem, shin problem. We evaluate them. And I do it right even at the very first evaluation at the end. It's called a functional test. And it takes about 30 seconds. So that's what's simple. In medicine, we like short tests that give us a lot of information. So as we get near the end of the exam, as they have an injury, I say, okay, now go ahead. Tell me what's the number one question you want to ask me. And I know already what they want to ask is, when will I be able to play again? And return to play is a big part of what we do. And very simply, in 30 seconds, I do a 6-step test. And our trainers know it, and they do the same thing. And then PTs, they know that it's a test I like. It gives us a lot of good information. It's, number one, just walk across my office from me. And number two, tiptoe back toward me. Can you get up on one foot and tiptoe? Number three is heel walk back across the office. And for some heel injuries or stress fractures, it's painful and they just can't do it because they're in too much pain or discomfort or weakness. Number four, in the middle of the room, I need you to hop 6 times, and the last 2 times to be your highest jump toward the ceiling on both feet, on the good foot, and on the injured foot. Most of the time by now, they can't do anything at all on a first evaluation. They can't even tiptoe, let alone hop. The final step is stand on one foot and close your eyes, a balance test on the good foot and on the injured foot. And so most of these kids, of course, with a new injury and a fairly significant injury, they get a 0 out of 6. They can't do any of it. And I do it with them anyway, and I tell them, when you are 6 out of 6, that's when you return to play. If it's 7 days with an ankle sprain, if it's 14 days, if it's 6 weeks with a stress fracture, when you can pass this 6-step test, you'd be ready to play again. Now, admittedly, with some, when we get closer to the end, we may take them back in the gym and do more advanced exercises. But for many practitioners, that 6 steps, teach it a lot with pediatricians and primary care docs. If they do those 6 steps and follow them in the office, as they get closer, hey, they can pass 3 out of 6 or 5 out of 6. I tell the kids when they're in my office, have you ever gotten a 0 on a test before in your life? Well, with your ankle sprain, you just got a 0 out of 6. When you can do those things, the ankle has to be about 75% of normal function to be able to pass that test. And so it's a very simple 30-second test that I've been doing for a long time. It gives us a lot of information, and it's a good tool or guide to know, are they making progress with physical therapy and rest and bracing and other things like that and getting closer to being on the court or the field of play.
Great information, Joe. Anything else on that?
No, that is really, lower extremity injuries are difficult. We see stress fractures occasionally in the calcaneus, in the heel bone, not very frequently. That will bother them when they try to heel walk across the office. But it's amazing to me how just hopping on one foot reproduces in 1 or 2 hops right where a stress fracture would be. Very common in our office are stress fractures, ankle sprains. As I talk to the residents and medical students this week, in our office we get a lot of what are called mimics of ankle sprain. Mm-hmm. So a lot of people, anything that hurts in the ankle, they call it a sprain. But there's a lot of other more complex things that can occur in the ankle. And after 30-plus years of seeing them, we see a lot of these other ankle problems. And some of them may be better in 5 to 7 to 10 days. And I tell the coach it's going to be day-to-day, and some of these may be weeks before they're ready to play, and then with a high sprain, it could take a couple of months before they're really ready to play. So it's very variable. we don't put a number of days on it on the first visit. We say when your function comes back, when you can pass that five-step test I gave you, that's when we'll start talking about playing your sport again.
Perfect. Joe, thank you, my friend. Sounds great. Good information. And we'll get you back on with us again next week at this time. Thank you as always.
Sounds good, Ray. Enjoy the week. Thanks.
You too, my friend. Dr. Joe Congini. He's the best. Sports Medicine Center at Akron Children's Hospital.